Hi, welcome back to the A&S Way. This is part 2 in the series of understanding how medical insurance plans work in the USA. If you haven't already, please go back to part 1 where I simply explain the basics of why you need insurance in the USA. And I do compare this from a UK perspective. Essentially, healthcare wherever you are, somebody needs to pay for it. In the UK, all taxpayers contribute so that everyone, irrespective of your age or whether or not you're working and contributing, gets access to healthcare. In the USA, that is not the case. Unless you are using Medicare or Medicaid, everyone else needs to ensure that they can pay for their medical services. And this is typically through a medical insurance and usually subsidized from your employer. Before I get into it, if you've just found our channel or you have been watching our videos and you haven't subscribed yet, please do subscribe. It greatly helps our channel. Now, medical insurance. I'm going to caveat everything that I say in this video with the fact that I am still learning myself. Me and Anne just moved here a little over 2.5 months ago. We came from the UK, used to how the NHS works, so this is completely new to us. So I am here to try and help you when trying to pick your plans as well. And I would say that there are broadly speaking, two main things that you need to consider when picking your plan. That is the total costs of the plan, and that is made up of your premium, deductibles, out-of-pocket costs, and I will come back to that. And then the type of plan it is, and that's typically meaning if it's a HMO or a PPO, whether you can get in-network or out-of-network services. Confusing? Yes, it was to me too, but this is the purpose of this video. I am going to explain what each and every single point means so that you understand. So how do you understand your total costs? I'm going to start there, and I'm going to assume that your insurance is subsidized from your employer because that's the experience I'm having. But as I said in the first video, I'm sure the logic applies if you are looking for insurance plans yourself. So the first thing that you need to look at is something called the premium. And this is the amount that you need to pay each and every month simply to have the insurance. Much like if you think about car insurance, you have the amount that you pay to have that car insurance. So that is your premium. And your employer will let you know how much that premium is every single month. And in my case, I have my premium coming out every paycheck, and in my case, I get paid bi-weekly. So bi-weekly, an amount goes towards our medical plans. Now, your premium will be affected by your circumstance. So who are you insuring on your plan? Is it just yourself, or are you insuring you and dependents, as an example, your spouse and children? Of course, the more people you're insuring, the premium will increase. Other things that can affect your premium are things like being a smoker. So when you go through and select your plan, they will ask you questions around who you want to insure and other questions around your lifestyle, such as smoking. In my case, I'm insuring myself and Aunt, so that affects our premium every month. The next part is to understand deductibles and out-of-pocket costs. Now, your deductible is the amount that you need to pay before your plan pays you back. This is very similar to excess in the UK with car insurance, so just think of it like an excess. It's worth noting that not every plan has a deductible, which means you can start using your plan straight away. However, there is some drawbacks to this perk in the sense that usually it means that the out-of-pocket maximum is usually much higher. But I'll come back to that in a moment. So back to deductibles. So this is the amount that you need to pay before it pays you back. And much like the premium, your deductible will increase depending on who is on the plan. As an example, me on my own, my deductible might be $500, but if my plan is for me and Aunt, the deductible that we need to meet is $1,000 before the plan pays back to you. This means if you need any form of medical services, let's say you go to urgent care, and you haven't met that deductible yet of $1,000, that means you would need to pay the total amount. Let's say going to urgent care, the fee was $500. you would need to pay that. So you wouldn't be able to claim anything back at that point. So just to be clear, your deductible is the amount that you need to pay before your plan starts kicking in. There are some cases when you do not need to make the deductible before the plan pays you back. And an example of that is preventative care services. These are things like getting vaccination shots, screening, all, as far as I'm aware, most plans need to be able to cover these services for free as part of your plan, in which case you do not need to meet the deductible to go for those services. So as an example, as I said before, screening, vaccination shots, there's a huge list on healthcare.gov for the USA where you can see all the preventative services that you can get for free where you don't need to meet that deductible. Now, the other example, and this is really dependent on your plan, some plans might say that if there is a co-payment, you do not need to meet that deductible. And an example of where you might need to make a copay is when you go to see your physician, in which case you don't need to meet that deductible, you just pay for that co-payment. Copays or co-payments are the next thing that you need to consider when you think about your total out-of-pocket costs. So we've talked about your premium, the deductible which you may or may not have on your plan, and the next part are these co-payments. These are the amounts that you need to pay every time you consume a particular service. And your plan will have a list of all the services from, say, GP visits, and they don't call it a GP visit, but I'm using that because I'm guessing you guys from the UK will understand that term. From GP visits to urgent care, A&E, all the examples of all the different services and what you will need to pay and contribute towards using that service, and the rest the insurance will pay for. So that's a co-payment. Now, the other term that you might see on your plan is something referred to a co-insurance, and this is typically in a form of a percentage amount. So the co-payment will have a dollar value. As an example, $25 to go and see your GP. A co-insurance will have a percentage, say 10%, 20%, 30%. And that's typically where it's a service where they can't determine the exact price. So instead of saying, well, you will contribute $100 exactly, it will explain the amount in a percentage. So you will pay 10% towards the fee. And that really works when you're going out of network, where they don't know how much that particular specialist or service is going to cost. So instead they say you pay a percentage. So co-payments, a dollar value, co-insurance is the amount that you will pay towards that service. To recap so far, we have talked about your premium, the amount you need to pay each month simply to have the medical plan. Then we have your deductible, the amount you need to pay before your insurance starts paying you back. And then your co-payments and co-insurance that you pay each time you use a service that is covered by your plan. So when does it end? You're probably thinking, right, I have my premium, I have my deductible, I have my out-of-pocket cost. It must end. And it does. All of those things are considered your out-of-pocket costs. But this is where it's important to know your out-of-pocket maximum. Each plan will have something called an out-of-pocket maximum. This is the maximum you will pay on that plan. And once you reach that amount, you will have nothing or no longer anything more to pay towards that plan. The insurance will 100% pay towards your services, as long as it's something covered by the plan. One thing to note, everything that I'm talking about is talking about that particular year. So when you're looking at your insurance, you are looking at your insurance premium that you pay each month for that year, your deductible for that year, and your out-of-pocket maximum for that year. But you can be really savvy about choosing your plan based around your health, and I will go more into that into the next video. But the more you understand your health, you can pick the type of plan that suits you. As an example, I mentioned some plans do not have a deductible, but instead have a higher out-of-pocket maximum. That could work for somebody who is quite fit and healthy, not really using services that much. So the likelihood of you reaching that out-of-pocket maximum is very unlikely. So you would probably pick the plan with the lower or zero deductible. If you are somebody that has a particular ailment, you use services quite a lot, the chances of you reaching that out of pocket is much higher, therefore that out of pocket maximum is much more relevant to you. So just think about, when you're picking your plan, what suits your medical needs. And that's one of the things that is actually quite nice here if you do have the choice to pick a plan. That is how you understand your total costs. Really easy. And I'm sure you're finding this video super helpful, so I'm going to pause for a moment whilst you hit that like button. Really helps the channel, so I do appreciate it. Now on to the next bit, the type of plan. So I've said there's two things to consider when picking your plan: your total costs, which we've covered and you're now an expert at, but then the next is the type of plan. So this is where we consider whether it's an HMO or a PPO, in network or out of network, which I have referred to a few times. But don't worry, I'm going to explain what that means. When picking a plan that's provided to you, or whether or not you're looking for yourself or it's something by your employer, you will find that there's typically two types of plans made available. A HMO, which is Health Maintenance Organisation, or PPO, which is Preferred Provider Organisation. And you can see that even I have to think about that. So what you will see is, as an example, Anthem PPO or Kaiser HMO as an example, and that tells you the type of plan. That PPO and HMO part tells you the type of plan it is. There are other types of plans available as far as I'm aware, but they're not as common as these two types. So for the purposes of this video, I'm only going to focus on HMO and PPO. Before I get into the detail of each plan, it is first important for you to understand what is it that you're assessing, what's the objective when choosing the plans. And really it's where you can go with the plan, the size of the network, certain rules. As an example, can you self-refer or do you always need a referral? And that is typically the differences between these types of plans. Starting with HMO, so this stands for Health Maintenance Organisation. With these types of plans, you do not, as far as I'm aware, have an option to go out of network. It means with a HMO, you must and can only use that plan in network. You do not have the option to go out of network. They usually have providers, so this will be doctors, hospitals, that they contract under their service plan, and they usually need to meet certain quality standards to be part of their health maintenance organisation. But the restrictions on that plan means that you can only go in network. If you did want to see somebody out of network, you would have to pay that entire cost yourself. The one caveat of where you can go out of network is for emergency services, and I think this is for all plans because you could be anywhere, and obviously you're not going to suddenly start, if there was an emergency, you're not going to try and find your network provider in that case. So that's the one caveat to that. Another part with a HMO is if you needed to go and see a specialist, you always need to be referred by your primary care provider. Your primary care provider is very similar to a GP in the UK, so you cannot self-refer. And that's very much like the NHS system. We have to go to our GP before we can go to see a specialist. We need that referral. The one thing I will note, and this has got nothing to do with this particular video, and I will share a bit more, but just wanted to share. The one thing I do like here in the US, when picking your primary care provider, you do have more options. You can look around, you can see who you want to pick, but you can also pick different types of primary care providers that specialise in different areas. As an example, as a female, you might want a generalist primary care provider, but you might also want a primary care provider that specialises in female health. And that's quite a nice part of the system that they have here. The last thing to note on HMOs is that typically they either have a very low deductible or no deductible and lower premiums. So that's some of the advantages of the HMO plan. Now on to PPO, Preferred Provider Organisation, and I always have to remind myself that. Now the advantages with PPOs is really flexibility. That is why people usually pick that, because you have more flexibility over the services that you can use. And with PPO, you have the option to go in network or out of network. And if you go in network, the fees are very set. This is where it's similar to the HMO. They will have very definitive prices on the co-payments and co-insurance. But if you go out of network, they will have the similar concept with co-insurance, but at a higher rate. One thing to note with PPOs, if you stay in network, your deductible and your payments will be lower. If you go out of network, they do charge you more. So as an example, let's say I'm on a PPO plan and I only use in-network services. My deductible might be $500 and my out-of-pocket maximum $8,000. If I go to a out-of-network service, then my deductible can double and so can my out-of-pocket maximum. So it's just another thing to be wary of when using PPOs, and just being very clear on the prices of your total out-of-pocket costs. You might be thinking, well, why would you ever need to go out of network? Well, depending on what's happening with your healthcare, you might want to go and see a very particular specialist, or somebody might have recommended a particular service from a particular doctor, and they might not serve the network that your plan is on. And now the problem, if you're on a HMO, you wouldn't have that option, or you do, but then you have to pay the full price of going to see that person. If you are on a PPO, however, you always have that option to go and see whoever you want. So that's really why you would have that type of plan. The other factor is that you typically do not need a referral with a PPO type of plan, and this is what people really love. Us in the UK, in the NHS, we're used to every time anything that goes wrong with us, we always go and see our GP and then have to wait for that referral and then go through that system of then going to see the specialist. If you're on a PPO plan in the US and you just want to see X specialist for whatever, you can self-refer. You can bypass that medium of having to go through the primary care provider. You can go directly to the specialist. And this is, and actually I have had somebody refer to me as, well, refer to this as the American dream, that you can just pick when you want to use your services, when it suits you. The ideal healthcare plan, apparently. PPOs essentially really do give you flexibility. It gives you the flexibility to pick who you want to go to. You can get to those services quicker, so it's the more flexible choice. There is a downside to that. PPO plans typically have a higher deductible, higher premium. So it's only a plan that's great if you can afford it in the first place. So HMOs, cheaper, lower deductibles, higher out of pocket. PPOs, higher deductibles, higher premiums, but then a lower out of pocket maximum. So you're probably thinking, well, how do I know which to pick? Well, that really depends on your personal situation. I'll start with discussing what me and Ant chose. This is our first year here. We don't really know yet how we're going to consume services, and we can change our plan at the end of the year. So in our case, we're relatively healthy. We barely use medical services. So for us, it made more sense to go for the lower premium and lower deductible. So we've gone for a HMO plan just for this year, just while we're still learning the system. If we did have more issues and we knew we was going to use the services quite a lot, and with that, we also wanted the flexibility of being able to pick where we go whenever we want, we would have picked a PPO plan. So I would say to you, just think about your situation, how you typically consume services. If you're moving from the UK, think about the last few years, your prescriptions, how many times you've ended up in A&E, if you've got any long-term, if you've got any underlying health conditions, and use that to figure out what works best for you, because the more likely you are to hit that out-of-pocket maximum, that probably is going to influence which plan you should pick. There you have it, the two things you need to consider when picking your medical plan: the total costs of the insurance plus the type of plan that you're on. So just think about what suits you And that may change over time. So do you feel like an expert now? Do you feel ready to pick your plan? Or perhaps you've picked a plan and you had no idea what you were picking and you just picked something. I would actually be really interested. Please let me know. For those of you who haven't picked your plan yet, you might find it a bit easier to come back to this video when you're picking your plan. I kind of wish I had this video when I was picking the plan, because I was really struggling and I had lots of colleagues kind of talking me through. So definitely come back to the video when you're picking the plan. You may need to pause it, kind of take it all in as you're picking your plan. In the next video, I do plan to discuss how you can be a bit more savvy when picking your plan based around your needs. You do not need to have the same plan forever, so you can pick one plan for the first year and then switch. But then you're probably thinking, okay, so I know what my out-of-pocket costs are going to be, that deductible. How do I plan for this? And this is exactly what I'm going to cover in the next video. How you can be a bit more savvy and use pre-tax money, Ant would love this, pre-tax money to pay your medical expenses through flexible savings account and health savings account. I will also touch on planning for your retirement. Maybe you move to the USA and you absolutely love it here. You have no intention of leaving, but then are concerned about, well, what happens when I'm retired? How do I pay for my medical costs? I will cover that in the next video as well. I want to stress, this process of coming to the USA, or maybe you've just arrived, may seem daunting, especially when coming from the UK system. But I want to stress, it doesn't need to be that daunting, but I also want to point out that healthcare always costs, and it's a huge bugbear of mine when people talk about the NHS being free. It is not free. We are all contributing and paying towards that if you work. It's free at the point of care. Healthcare, wherever you go, and I mentioned this in the last video, always has a cost, and this is just where the UK and the US system are different. This very much relates to the tax series that Anton has been doing, and he's going to love the plug for his video, and this is something that he's very, very passionate about. But please go and watch those tax series videos if you haven't already. But the thing I want to point out, the UK and the US both have a progressive tax system. They are both the same way when it comes to that. The more you earn, the more you're taxed. The way that they are very different is how it relates to the healthcare services that the countries provide. And this is where they are vastly different. In the UK, because we're all contributing towards the national health system, when you're at the lower end, or maybe you don't earn any money and you're not paying into that system, that healthcare is actually completely free to you because you're not inputting. If I'm on a low income, I might be contributing something like £1,000 every year towards the NHS, to somebody who's a high earner, possibly contributing £10,000 every year towards the NHS and only using a fraction. So that's the UK system. The more you earn, the more you pay in taxes, and the more you are contributing towards the NHS. Therefore, healthcare becomes more expensive for you the more you earn in the UK. In the USA, it's the complete opposite. They don't have that system. In here, they recognise healthcare has a cost. It has a very distinct cost, and you need to figure out how you pay, irrespective of how much you earn. They do not take into consideration whether you're on a low income or at a high income. It just has a cost. So you need to figure out, the onus is on you and your employers to make sure you have a medical plan and that you can meet those out-of-pocket costs for your plan, irrespective of how much you earn. Let me know if you found this video helpful by commenting below and hitting that like button. I said this before, if there's anything that you want to know about how medical insurance works that I haven't covered or you think I should cover, please let me know. And if you haven't already, please do subscribe. Thanks for watching The ANS Way.